Dada jenis heroin, anggaran
Seorang ibu dan anak sulung dalam
Hi, I am Aizara, Professor of Psychology at University of Pengasih.
Assalamualaikum and a very good morning. Welcome to our forum that organized by Physiology Psychology. My name is Aimadia and I will be your MC for today. Okay, in this forum we will talk about substance abuse, but specifically we'll talk about opiates. Actually, drug abuse is not something that we are not familiar with it. Nowadays we often heard or see the news on the newspaper, television or any medium about the drug abuse. It's a very complex issue and has been a serious public health problem in Malaysia. According to National Anti-Drugs Agency or NADA, there are several types of drugs that Malaysian people commonly use, and opiates is one of it. So without wasting any time, I want to ask Dr. Azhara. Okay, doctor, can you tell us more about opiates, such as what are the common features and some example of it?
According to DSM-5, substance abuse or substance use disorder are defined as a collection of symptoms including tolerance development, withdrawal, uncontrolled increasing intake, and also craving for a substance. So one of the substances is opiates, which are under the category of opioids. So while opioid use disorder is similar to other substance use disorder, it actually has several unique features. So opiates can lead to physical dependence within a short time, which is 4 to 8 weeks. And for the chronic users, stopping the use of opiate can lead to severe symptoms. So not only it is illegal, but a person must take an increasing amount of drugs to achieve high, which is costly and also very risky, as can lead to death because of overdose. These are the examples of the opiates, and one of the popular opiates used in Malaysia is heroin and morphine. And as you can see at the statistic, there are decreasing pattern over the year.
Thank you, Dr. Azhara. It's a very good explanation about the opiates. So next, I want to ask Dr. Ainun. So doctor, what are the positive or negative reinforcement that involve in people using opiates?
So according to anesthetic concept of addiction, both positive and negative reinforcement contribute to the addiction of a substance. So what is that? Positive reinforcement is the addition of reinforcing or pleasant stimuli, while negative reinforcement is the removal of aversive or unpleasant stimuli that makes a behavior more likely to occur again in the future. When taking opiate, users will likely to have a sense of euphoria, which is the feeling of intense excitement and happiness. However, during withdrawal, users often experience chills, sweat, cramp, and diarrhea, and it stops when they relapse. So in our case, the motivation and drive for opiate taking behavior is a transition from positive reinforcement, which is to feel the euphoric effect of opiate, to the negative reinforcement, which is to remove the aversive effect of withdrawal.
Usually, when we talk about substance abuse, there must be some factors that lead people to use it. Dr. Tibia, what are the factors that lead people in using opiates?
Actually, genetic variations can influence a person's response to drug and the risk of drug dependence. The tiny differences in a person's DNA, which is termed as single nucleotide polymorphisms, SNPs, can indicate whether a person has a higher or lower risk for addiction. Next, untreated neuropsychiatric disorder and history of chronic pain are also major contributing factors of opiate abuse. Studies also have indicated a relatively high incidence of opiate abuse among minority ethnic groups with low income and those who live in remote areas. Next, if a person had a substance abusing behavior in past or currently engaging in a substance abusing behavior, the chances for him to become opiate dependent is also very high. Finally, family environment contributes to opiate abuse. For example, if a person has a family member who abuses drug or has a family member who has a normalized attitude towards drugs, the chances for the person to become opiate dependent or drug dependent is also very high.
Dr. Nalini, can you tell us more in details about why we should not try the drugs, or I would say opiates?
Yes, so the misuse of opiate can lead to physical dependence and addiction. Dependence on opiate is happen when the user experience withdrawal symptoms when not using the drug. The individual will need to stop using the drug gradually in order to avoid withdrawal discomfort. Next, opiate addiction happen when there is a compulsive urge to use the drug even when they are not required medically. According to the Center for Disease Control and Prevention, as many as 1 in 4 patients receiving long-term opiate treatment struggle with opiate addiction.
What are the short-term and long-term effects if we keep taking opiates?
The short-term effect of taking opiate is it is sedative, pain reliever, and high cost due to tolerance, which means a person must take increased amount of drug to achieve a high. The long-term effect is it causes changes to the prefrontal cortex and medial temporal lobe of the brain. Those areas control and regulate long-term memory, decision-making, thought processes, and social behavior. Brain alteration from long-term opiate use can cause several behavioral changes like memory impairment, poor problem-solving skill, decreased ability to plan, and reduced decision-making skill.
So doctor, is there any differences between men and female in terms of effect of opiates to our body?
Some research suggests that women are more sensitive to pain and may experience chronic pain more often than men. Women are also more likely to misuse opiate for self-medicate for pain or anxiety and develop a dependence on opiate faster than men due to a heightened dopamine response in the brain.
Dr. Mai, could you explain to us on the effective treatment in terms of biomedical and psychological aspect?
Hi guys, my friend Professor Bart said that treatment for opiate addictions require long-term management. There are 2 types of treatment, biomedical and psychological treatment. In biomedical treatment, we do maintenance medication. Maintenance medication is medication on a consistent schedule for people with addiction. Our 3 main choices for medication to treat opiate addictions are methadone, buprenorphine, and naltrexone. The first thing we do is detoxification using methadone. Detoxification or detox is the process of letting the body remove drugs in it. The purpose of detox is to safely manage withdrawal symptoms when someone stops taking drugs. Patients should wait until they are experiencing mild to moderate opiate withdrawal before taking the first dose of buprenorphine. Both methadone and buprenorphine associate with retention in treatment, reduction in illicit opiate use, decreased craving, and improved social function. And our third medication is naltrexone. Naltrexone works by blocking opiates from acting on the brain, so we don't get the feeling of high or euphoric. It's a good option for preventing relapse, but may not stop all drug craving. For the psychological or psychosocial treatment, there are many types of treatment you can do, such as cognitive behavioral therapies, motivational enhancement therapies, and multifamily therapies. Research has shown that these treatments show significant improvement in several areas such as employment and support, drug use, and psychiatric condition. However, this type of treatment should only be administered after the detoxification of opiates.
So doctor, if they want to change or seek help, where can they go and who can they call?
For further information or help, you can go to the National Anti-Drugs Agency website AADK, or you can contact them through the number below. Other than that, non-government associations such as Serum Retreat or Pengasih House.
Thank you, Dr. Maisara. I think that's all the questions that I want to ask to our panelists today. So from this forum, now we all know the reason on why we should not take the drugs. It is not only cause harmful to ourselves but to the other people who are around us. It is hazardous to the society and many lives have been run by this thing. We may feel good after taking the drugs, but it's only for the short-term period. So I hope for those who are watching this forum are able to educate other people and spread the awareness on substance abuse. Last but not least, stay safe and love yourself. Assalamualaikum and see you guys in the next forum.